Hi, I'm Dr. Robert Kachko here with a friendly reminder that our patients need us now more than ever. Our patients need us now to carry a message of hope, to offer clear guidance and grounded understanding. Though, much like you, I often rely on in-person encounters to offer the type of support people need. That's simply not an option right now. But what I do know is that I can fall back on the therapeutic relationships that I've built over the years to help people understand that they're not alone, even if we're connecting with them virtually. I also understand and have been talking about for years the role of social isolation and the role of social distancing in negative health outcomes. We know that when people feel lonely, they're much more likely to have higher risk of heart disease, higher risk of chronic pain, higher risk of diabetes and cancer. But what we also know is that we can mitigate those effects with the right type of social support. We have to give people the support and the understanding they require where and when they need it. And just as importantly, people who feel supported, people who don't feel alone, are much more likely to make the behavioral changes that are necessary for lasting outcomes. Very often, the thing that falls off first for people with a total and drastic change of their routine is the type of behavioral change that we know helps them to stay resilient to these crises. We know that if people are sleeping well and eating well and digesting their food properly and moving their bodies, they're much more likely to mount the type of immune response that they're looking for these days in vitamins and supplements, which do have a role to play. But we also know that if we don't have frequent and encouraging touch points with those patients, it's very easy for those behavioral changes to go away. And I know that in my practice, I'm relying on peers, people with lived experience of the types of chronic disease that our patients are dealing with. So we all have this common lived experience right now. Everyone's feeling the fear, everyone's feeling the uncertainty, and that uncertainty in and of itself is making things worse. But there's nothing quite like the value of peers, people who are trained on a model to offer support and understanding as an adjunct to the care that we provide. Not as a replacement of our care, but as a way to make that care and the changes required of that care less overwhelming in a time of crisis. I urge you to find resources to help your patients connect with each other, to help patients connect with trained peers, so that the recommendations that you're making can be carried through during this crisis. Please be safe, take care of yourselves, take care of your patients. One of the best ways to reduce the impact of social isolation and social distancing is to be of service. And so we can be useful to our patients at this time, but being useful to our patients is also really important for ourselves to sustain us and to allow us to continue to do this soul work. So thank you for listening. Please consider the role that social distancing might be playing in the care of your patients.